Okay, who hates back pain? I do. One thing I suffered from, years ago was recurrent back pain. It happened every few months, and it'd get me out of the gym and it'd get me out of being active. I couldn't even pick up my little kids. So back pain can really, really plague a lot of our lives. And when you get it, it's no fun, and it's all the time. And some people suffer from back pain constantly and it doesn't go away. I'd say the second most common thing we see here is low back pain after knees. Just a ton of stuff with low backs. In fact, when I first became a doctor and started treating patients, I dreaded seeing a low back pain patient because I did not have a lot of options that were great. I could prescribe some steroids. I can give a prescription for pain medications. Nothing else was working, and I'd send them for surgery. 15 years later, fast forward today, it's one of my favorite things to treat our low backs. We have some of the best outcomes with our back treatments in the nation because our goal is not to cover it up. Our goal is not to do another steroid shot. By the way, did you know that steroids in the spine increase the risk of a spinal fracture by 1/3? Now, that was a study done over 6,000 patients. So the last thing I want to do is give you a spinal steroid epidural. Now, we can do some different types of epidurals that don't use high-dose steroids that can calm your pain down. We can do other shots in the back that immediately help with the nerve pain and the muscle spasms in your back. But most patients want something more long-term, and that's where our great success rates comes from our PRP lumbar procedures. It's kind of a procedure that I've kind of coined and teach doctors all around the world how to do this very precise, specific procedure where we treat the ligaments, the fascia, the muscle attachments, the joints, the facet, the SI joints, and then at the very end of it, we actually add an epidural using growth factors from your own blood. So it sounds a little Star Wars, but it's pretty amazing what we can do and the number of patients who are back into action, they're running again, they're lifting their kids. So actually nowadays, the low back's are one of my favorite things to treat.